balloons, bazookas, boobies, bosoms, boulders, cans, hooters, knockers, melons, honkers, jugs, rack, tatas, tits, torpedoes, guns, bust, doorknobs, coconuts, and our favorite one, the girls. Welcome to the All About Breastfeeding show, where your host, Lori, highlights mothers just like yourself and goes beyond the surface questions and digs deep so they share not only their joys and happiness in their daily breastfeeding life, but also their pain and struggles and how they worked through them.
Episode number 130. Welcome to All About Breastfeeding, the place where the girls hang out. I am your host, Lori Jill Eisenstadt, IBCLC, which stands for International Board Certified Lactation Consultant. Today is FAQ Day, number 10 out of 12, and today we will be talking about engorgement. I want to first remind you about our Facebook page where you can join us so you can interact with me and other listeners. We have some great conversations about pumping tips and milk storage tips going on this week. What kind of bags to use, how to store your milk, tips and tricks of the trade, so you can learn from other new mothers what works best for them. Moms in the group also lend some support to other moms who are having some breastfeeding issues, and other moms are giving each other high fives for passing that 1-month mark of breastfeeding. So come and join us. All you need to do is go to Facebook and search for these 4 words, All About Breastfeeding Community. I look forward to introducing yourself and getting to know you better. Some more fun for you to check out. I have had many people ask me how I can help them with breastfeeding. I can easily answer some questions via email or in the Facebook group, but there are many other times that you have breastfeeding struggles that just need individual one-on-one attention to really see what's going on and help you resolve your challenges. You can go to allaboutbreastfeeding.biz to learn how to schedule an appointment with me, either locally or virtually. Also, be sure to listen in next week as I have a few announcements that I will be making. I hope I have you wondering, have you curious? Well, we shall see. You have the whole weekend to wait and wonder. Okay, as you see, I like to have fun with some things. Let's get to today's show where we're going to be talking about engorgement. Welcome to the club of early newborn breastfeeding and being one of many of us that find ourselves in the same boat. We are rather clueless about how the whole breastfeeding thing works. For some of us, just like other things in life, breastfeeding comes rather easily. For others, the learning curve is quite steep. That was me for sure. I was in the quite steep club. For some, your body seems to cooperate during the early days, and even though you're stumbling around, your body and baby figure it all out and you are no worse for the wear. And for others, like myself, we wind up with issues such as what we are talking about today, engorgement. My goal today is to give you enough information so that you can decide for yourself. Are you okay on your own? Or is it best to call an IBCLC for expert help? So if you've gotten to know me, you know that I am all about education and prevention. As far as engorgement goes, a definition is that it is a swelling or congestion of body tissues. When we are referring to breast engorgement, we are describing the painful swelling that occurs when the breasts become very full and very firm. Sometimes the breasts are actually hard, and all these sensations lead to very painful breasts. They can feel very heavy, sometimes throbbing. You notice your skin is quite stretched out, and sometimes this fullness and firmness and lumps lead all the way, incredibly enough, yes, to your armpits. Engorgement can affect one or both breasts. There's a myth I often hear moms say that they think engorgement is a normal part of early breastfeeding and that it's normal for it to last for many days. This is a myth that I want to bust. I want everyone to know it is not normal to be engorged for many days. This tells us something is not quite right. It is normal for your breast to soften up after a good feeding or pumping. In between milk removals, it is normal for your breast to begin filling up again and getting heavy in preparation for the next feeding. This cycle of filling up, feeling heavy breast before feeding, and feeling much lighter and softer with some jiggle after a feeding is quite normal, particularly in the early weeks of breastfeeding. However, when you continue to be heavy and firm with little to no softening and little to no relief after milk removal, you are suffering from engorgement. When this happens, it is usually the result of the lack of milk removal or the infrequency and inefficiency of the milk removal. Here is what typically precedes engorgement. At birth, with your baby in arms and the placenta out, this triggers a shift in hormones that stimulate the production of milk. Increased amount of blood and lymph circulate in the breast tissue and are the source of many nutrients from which the milk is produced. I like to say that all this goodness goes into the breast, which is a milk-making factory. It goes through this process and comes out looking different colors at different times. Commonly, you will first notice a yellowish color or even a clear color. Within a few days, you will notice a whitish color, sometimes even a bluish color, all very normal. Breastfeeding is often a learned skill for most of us, and it takes quite a bit of practice to get pretty good at it. Sometimes during the learning phase, our body seems to adjust to how much milk we need to satisfy our babies and not much else left over. And other times, we are making way more milk than our babies need. Or the milk removal is not efficient enough and engorgement occurs. When the milk is being removed frequently enough and efficiently enough, the body can handle this increase in fluids, which is milk, blood, tissue fluid retention, sometimes from the IV you got during the birth. And any engorgement that you have should really be gone in 48 hours, tops or less. If it lasts longer than 2 days, I really urge you to seek the help of an IBCLC. Why? Why should you seek help if you're suffering from engorgement? Why not just hang around and wait a few days for it to be gone? Well, I have at least five excellent reasons why you should seek help for unresolved engorgement. And here are my top 5. Number 1, engorgement can literally make you feel ill, make you feel sick. Number 2, engorgement can make it difficult for you to get in a few good naps because you're so uncomfortable. In fact, it can be quite painful. I work with a mom today that was so full and so hard with lumps that it literally hurt her to drop her arms along the side of her body. And she can't sleep on her stomach because she just had a baby 3 days ago. So she needs to sleep on her side. She's not comfortable on her back. But if she sleeps on her side, it's putting pressure against her engorged breast, and that's painful. So she's kind of miserable when she saw me. We worked it out, but she was miserable when we first started. Number 3, engorgement can make it difficult for your baby to achieve a good latch and breastfeed well. Here's what happens. Your breasts are not just full, but they are very hard. Your nipples may become flattened as the skin stretches under the pressure. Hard breasts and flat nipples are never a good combination, as it makes it difficult for babies to achieve a good latch. Number 4, engorgement can send a very strong signal to your body to decrease the milk production, which puts you at risk for an overall low milk supply if this should continue. And you're probably saying to yourself, what does that mean? Engorgement sends a strong signal to your body to decrease the production. Well, this is true. What we know is that the longer the milk stays in your breast, the stronger the message is that you don't need to make all this milk. Spend a few days being engorged, and by the third or fourth day of life and poor milk removal, you are at risk of making less milk than what your baby needs. Number 5, the pain and swelling from engorgement can cause a baby to have such a hard time latching on, and this improper latch or suck, now that causes you, the mom, to have problems letting down or releasing your milk. You quickly realize that you are now in a very bad situation. You have all this extra fluid and you just can't get it to flow. Your baby can't latch on, and if your baby doesn't latch on, it's likely to cause painful feedings. This increases mom's frustration and anxiety, which causes her to have a problem letting down, making things that much worse. Yes, it is a vicious cycle, and one that I want to help you avoid so badly. Prevention. What can you do to prevent engorgement? The top tip that I have for you to prevent engorgement is initiating breastfeeding within the first 1 to 2 hours of birth. Learn what babies' hunger cues are like when they want to feed, and learn how your baby looks when you notice these cues. Do not hold your baby off from feedings based on what the clock says or a book, a doctor, or anyone else tells you. Your baby cannot read time or understand what other people tell them. Your baby only knows that they're hungry, and they cue. They let you know, bringing their head side to side, sticking their tongue out, moving their arms about, and if you don't get to them quick enough, they can pretty escalate to a very loud cry. If you cannot or are going to be separated from your baby for many hours, you need to begin pumping to remove the milk on a regular basis. Perhaps you will begin removing the milk by hand expression. Perhaps you will use a pump. I really like hand expression in the first 3 days because it gives you much better control and it helps you capture the milk in a small container, which is easier than when pumping. And typically it enables you to collect more milk. This gives me the opportunity to talk to you about hand expression. This is a good tool to have handy for when you do not have a pump available or your pump parts are broken and you feel very, very full. I will put a video in the show notes that walks you through hand expression. I really encourage you to take a look at the video and really learn what hand expression is about. So if it comes a point where you need to use it, you already know how. This also gives me an opportunity to talk to you about one of my most favorite mom-invented products, and this is the breast bowl, which one of my guests, Mel, has created. Feel free to go back to her show, episode number 76, and you will meet Mel, hear her story about why she created her beautiful glass blown breast bowl. This bowl is so beautiful when you're hand expressing. You just see your milk spraying into this beautiful, colorful bowl, and it's almost like your milk has color of the rainbows. It's really cool. Mel actually just had another baby herself, so congratulations to Mel if you're listening to this. I have some additional and other necessary tips to help prevent engorgement. Frequent and efficient feedings are both great helpers to reduce the incidences of engorgement. Efficient means the milk is actually being removed. No sleeping or poorly attached babies allowed. This will just not get the job done. Avoid pacifiers so you can observe baby feeding and not miss their feeding cues. Unless it has been shown to be medically necessary, do not supplement baby with formula in a bottle. Always request expert help if you are unsure about proper positioning latch milk removal. If you are new to breastfeeding and you feel your latch is pretty good, it is still great preventative medicine to have a latch check with an IBCLC. Just in case you are not sure, I will repeat. It is the frequency and the efficiency of the milk removal that will help you to prevent engorgement, particularly in the early days. I really hope this information has prevented you from getting engorgement. But just in case you do find yourself engorged, I have some tips for you to help relieve your engorgement. But I really want to tell you, I know I'm a pain in the tush. If significant improvement is not seen in 1 to 2 days, I really urge you to seek professional help. One thing that you can do is use warm shower. Showers with the water running down your breasts, it could be very comfortable for you. Some moms, they've had damage to their nipples and it's not comfortable. So the best that you can do is turn around and let the warm shower flow onto your back. And while you're doing this, whether you're facing the shower or your back is to the water, you can try hand expressing some milk. You may have to spend a few minutes hand expressing before the milk begins to flow, but it can be a good way to help relieve the engorgement. You can also try putting warmth on your breast tissue for about 10 minutes before a feeding. And you can do this with warm washcloths. If you are concerned that your baby is not removing the milk efficiently, begin hand expressing or pumping after or in place of each feeding. You can try reverse pressure softening, otherwise known as RPS. If you go to the show notes for this episode, there's more information on reverse pressure softening. These are simple techniques that you can do at home. There are other steps that you can take to help relieve engorgement and to make you feel more comfortable during this short-lived phase. And these other tips are ones that you should really be working with an IBCLC. So if warmth and hand expression does not help relieve you, pumping doesn't, and reverse pressure softening doesn't, you definitely want to seek some expert help. The focus on today's show was on engorgement in the very early days of breastfeeding. This is the most common time period for mothers to suffer with engorgement, the very early days. However, engorgement can happen anytime. Yes, even when your baby is many months old. Now, this was not the focus of today's show. However, I do want to list some of the most common reasons why engorgement occurs after the first few weeks of lactation. It usually happens when the breastfeeding or milk removal has an abrupt change, such as a baby all of a sudden sleeping for many more hours through the night or just longer during the day than you are used to. Some mothers, their bodies are so sensitive to this abrupt change, the milk gets kind of backed up and your breasts get engorged. Another common time is during the weaning process. If the weaning is gradual, then it's less likely to occur. If it is parent-led weaning, meaning the mom says, okay, it is time to wean, and we are either going to do it on my timeline or something happened that it needs to be done abruptly. Now, if you do parent-led weaning, it's less likely that you're going to get severely engorged, but more likely that you're going to get some degree of engorgement. When you have to wean abruptly, particularly for a health issue or surgery, This abrupt change can often cause severe engorgement, particularly if the mother has had a full supply. If she was at the point where she was hardly making any milk, severe engorgement is less likely. A bit of uncomfortableness is likely. In these instances, it's just too much information and you really need to know the individual situation. So I'm not going to give specific ways of how to help yourself other than being that pain in the tush that tells you to get experienced help to help you get through this. When engorgement happens and it is abrupt, you can really increase the risk factor for getting a breast infection, and we just really want to avoid that. So the biggest take-home messages I would like to share with you about engorgement is, number one, please do not accept the myth that engorgement is normal, because it is not. Number two, please take steps to get help as quickly as you can if you are realizing that your baby is not doing a good job of removing the milk. If your baby isn't doing a good job of removing the milk, it's often causing you painful nipples, it causes your breast to get engorged, and it causes poor milk transfer, which means your baby is probably not getting enough milk, and it just sets off a whole chain of events that cause more breastfeeding problems. Number three, if you are having a difficult time removing the milk, you definitely do not want to let engorgement go beyond 24 hours if you are not making progress. A delay in getting help could mean a significant drop in your supply. It could increase your risk factor for clogged ducts and a breast infection. Number six, you can see why I'm a pain in the tush about wanting you to have the tools to help you distinguish between being okay on your own or pushing you to get experienced help. So basically, the breasts fill up with milk. Your baby should be coming to the breast with a nice, good, deep latch that's comfortable for you and transferring enough milk to make your baby happy, their belly full, and to soften up your breast significantly for every feeding. And if you're going more than a day or so with the breasts continually getting full and fuller and fuller and less relief when your baby's done feeding, that's a signal for trouble, for a whole cascade of events of breastfeeding. That's why you really want to get help. Okay, so I hope this information was very helpful for you. You do want to go to the show notes because there is information on the breast bowl. I will have information and a link for hand expression, and I will have a link for reverse pressure softening. So lots of information there for you to get in addition to everything we went over today. It will help to support the information that I talked to you about today. Today's words of inspiration as I close out the show. Mother and baby will learn the art of breastfeeding with time, patience, gentle guidance, and practice. Breastfeeding is a combination of instincts and learned skills for both mother and baby, and it may take a while for breastfeeding to become familiar to both of them. What I really want people to know is breastfeeding is this natural thing to do, but it doesn't necessarily come naturally. There is a learning curve. Until the next show, bye-bye. Have you heard that Phoenix, Arizona is blessed with an amazing birthing center? Baby Moon Inn Birth Center is the best option for families who want access to midwifery care in and out of a hospital setting. You can experience birth in a comfortable home-like setting where natural birth is the focus. Laboring in water, being able to walk outside during labor, and enjoy the beautiful garden. This is what birth can be like for you. There is so much more to learn about Baby Moon. The staff would love to have the opportunity to meet you and would like to extend an invitation for you to attend a free Choices in Childbirth class and a tour of the birth center. All you need to do is call 602-314-7755. That's 602-314-7755 and ask for the tour dates. You can also go to allaboutbreastfeeding.biz/podcast. And on the right-hand side of the page, you will see a link that will bring you to the calendar, and you can sign up for the tour yourself. When you come in for the tour, make sure that you tell them you found out about it from the All About Breastfeeding podcast, and you will be given a very lovely free gift.